Hey everybody, it's Dr. Dennis Mariano, and this is our transformational healing seminar. And today we're going to be doing a special, which is you can ask any question you want with regard to holistic care or any difficult cases that you may know. Again, Dr. Dennis Mariano, Mariano Holistic Life Center, and this is my assistant Jody.
Hi.
And Jody has a very unique perspective on health because she had come from a traditional background also, but she also had experience with working with another doctor of chiropractic years ago. And what we're going to be discussing tonight is her perspective and what she's experienced in our practice, that her being new here, is to find out exactly Q&A, any questions that people, hey Brendan, good to see you. We'll see you tomorrow morning. She's going to ask us any questions regarding what she feels is the most frequently asked questions that people have in our practice. Hey Brendan, can you hear us? Or is the microphone okay? Okay. All right, so Jody, go ahead and get us started.
Okay. So I hear a lot of our practice members or people out in my world day to day that ask if their infants or young children should seek chiropractic care. Right.
So the answer to that is absolutely yes. And why is that? Because why do you think infants and children need to be
as I'm learning now that the birth process is a pretty big traumatic process, no matter how you come into the world.
Right.
And it can wreak havoc on your body early on.
So yeah, for example, this is a baby here, and you can see the cranial bones are shaped a certain way. When the baby's first born, these cranial bones are actually separated. So recently we just had a newborn infant that was brought to us because that infant had a difficult delivery, and what they did is they actually had the vacuum extraction used to pull that baby out. If you can imagine the amount of pressure that that exerts on the baby's neck can actually create misalignments in the vertebrae of the spine. And all these vertebrae in the spine control all the functions of the vision and eyesight and hearing. And what we find in our practice, many of the traumatic births, whether it could be, think about cesarean too. Most people think that cesarean is a very easy birth. I mean, is that true?
No.
No, why? What makes cesarean difficult?
Well, first of all, it's generally not, it doesn't seem to be the woman's first choice.
Right.
But it's not a natural process, so it's being interfered with tools and doctors and medications.
And so what they do is they cut the uterus, and when they don't cut a mile wide uterus so the baby can pop out. They try to minimize the amount of cutting, so this way the scar is minimized as well. But at the same time, you still have to pull that baby out. So our experience in chiropractic is that when the babies have a difficult delivery or traumatic birth injuries, they actually can create issues like colic, ear infections, asthma, allergies, and so on. So yes, infants should definitely, in our practice, it's a practice of ours to check infants as soon as they're born, and we usually do that at our expense. But yeah, the cranial bones also can become misaligned, creating all sorts of issues with sinus issues, ear infections, and so on.
And aren't they not fully closed after the baby's born for a certain time?
Here's another misconception. We are taught, if you look at the anatomy books, that our cranial bones are actually fused together and they're immovable. Mm-hmm. That's totally not true. This actually is a CSF flow that goes through there, which allows the nervous system for the cranial bones to move back and forth. It pumps the cerebrospinal fluid through your system. Very critical to understand that. Mm-hmm. Does that answer your question?
It does. Okay. And what I'm learning is that I did not know is that if babies come early, if they come in and are brought by their parents soon after birth, or at least as they're a younger child, it can help prevent such a myriad of problems in the future with kids that have so many ear infections and various things that are, skin problems and asthma issues. And
the reason why that happens is that most people that don't know, if you look at this chart here, I know it's backwards because we're on the other view, but look at all the different organs, the senses that the nervous system controls. If you have a misalignment in this part of the spine, you definitely create distortion up here. It's going to create sickness in that body. And those babies, they're rapidly growing, and it's really difficult for them to adapt to the environment, and there's a lot of stress in the nervous system.
And if you can give them the best head start, as a mom, I wish that I knew about this, or this was in my realm of thinking when my kids were small. They're, bigger now. It's not that it's too late. It just would have been lovely to start earlier and to have, given them the best chance that would be possible in a healthy life.
Right. If you think about the brain in the very young child, in the young infant, that brain is rapidly developing. It's trying to integrate everything for the environment. It's trying to make the digestion. It's trying to grow. There's so many issues that are happening, that are developing, that if there's any interference between the brain and the nervous system and the organs, that's going to create distortion and a diminishment of the function of that body and the development as well.
I've heard many people ask if chiropractic care in general can help with seasonal allergies, food allergies, just overall problems with sinuses, if that is something that is commonly treated with chiropractic care.
So here's the thing. The one thing people need to understand, chiropractic is not a treatment for any condition. So treatment indicates that treatment is really what is used in the medical profession because they have diseases or conditions they try to treat. In chiropractic, what we do is balance the nervous system in such a way that you allow the system to regulate itself. Because again, if you look at the nervous system here, this is basically your hard drive, and that if you have distortions to the hard drive, the system's not going to be able to function optimally the way it's supposed to.
So it's like you're helping with any interferences so that we can work better, our bodies can work at functioning as they're supposed to, as opposed to needing interference from outside sources like medication or...
Right. And you know what? Listen, we're not down on medication. God forbid that something happens to you, you get injured, or you have pain. Medications were designed to be used short term, so that until the body can recover. But the problem is when people don't understand it or don't know that there is an option to allow the body to naturally heal because they're not knowledgeable about it, then you just use the tools that you have, What did they say? Somebody said once that if all you have is a hammer, the whole world starts to look like a nail. So that's not the way it works. There are many options of how the body works. Okay.
Do you recommend chiropractic care?
Let me answer the question. So get back to the question, asthma, allergies. So here's what we find out. There are always 4 causes to any kind of problem, a health problem. There's usually a physical cause, which involves the spine and nervous system, a chemical cause, which could be environmental, your diet, nutritional deficiency, toxicity. We're finding now when we do our lab work in our practice, we also do functional medicine work, that we're finding people are full of heavy metals, lead, mercury, aluminum, arsenic, all these things. So all these things can create weakness in the immune system. And one of the most important ones is emotional stress. So when the body gets emotionally stressed, it creates weakness in the organs, creates weakness in the immune system. What we found out with regard to allergies that we have really good results with, and what did you say, allergies and what else? What was the other condition?
Skin or sinus issues.
Yeah, sinus issues. These are all autoimmune issues. That means the body's in a heightened state of immune compromise and inflammation. And so we always obviously want to make sure that the diet's appropriate. You want to make sure the nutritional protocols are appropriate so the body's not in deficiency. Because you know what? You can get your nervous system balanced, but if you're constantly inflamed because you're eating processed food, that means your gut's always inflamed, and your gut is 80% of your immune system. So you can't fix
every time.
What's that?
Every time I am amazed by that. 80% in your gut.
Yeah, it's in your gut because that's called the enteric nervous system. It has its own nervous system. The most important thing about that too, is that your enteric nervous system has connections directly to the brain. So the neuropeptides that travel all throughout from your brain to your body. The one thing I began to realize after all these decades of practicing for 26 years now is that your body is really one connected unit. There is no separation between your neck, your back, your physical, your emotional, your chemical. It's one whole thing. Everything's connected. It's one integrated unit. So by allowing the body to be cared for in an integrated way, then you allow the body to heal optimally the way it was designed to do. I've
seen, you've also are really experience with treating pregnant women and
caring for, right?
Caring for pregnant women, and I found it amazing that you were able to help to not only adjust the mom so that she can be in a proper position to have an easier delivery and help
let me explain to you how that works. So when it comes to pregnancy, it's really critical that the mom who's pregnant get under care. But first of all, they should get under care before they're pregnant, so this way the spine and nervous system is functioning optimally. When it comes to the pelvis, right? See the pelvis here, the uterus sits here, and the baby is in here. Now think about that. Think about the articulations of the hips, the sacrum, the lumbar vertebrae, the pubic bone in the front. When that baby's ready to be delivered, there's really not much room there, right? There's not much room in there. It's pretty tight in there. So therefore, if a mother has any misalignments in the spine, whether it could be the pelvis could be misaligned, the hip could go posterior or anterior, the sacrum could rotate this way, the base could rotate, the apex could rotate this way, the lumbar vertebrae can rotate this way and also compress the nerves. When those nerves begin to compromise the uterus can't contract properly, and the feedback mechanism from the baby feeding back to the mother becomes diminished, and therefore the body can't comprehend itself, and then the baby. So it's very critical to have the moms balance their nervous system so that this way they can have a delivery that's natural as opposed to intervened with because of the difficulty.
I would think it also helps the baby be more relaxed and,
Yeah. And so here's another thing. So what we find is that if the uterus is properly innervated because you have a balanced pelvis, when the uterus contracts, it actually contracts from the top and then to the bottom. It's a massaging action to get the baby out. When they try to induce the baby to come out when it's not time yet, or because the mother is having difficulty laboring, the contraction, the pitocin, instead of the oxytocin in the blood, the hormones that allows the body to contract the uterus, it actually the pitocin actually contracts the uterus all at once. So what happens is you jam the baby in the birth canal, and that's why you begin to have labored breathing, drop in blood pressure, and it becomes an intervention now. It becomes a disease intervention rather than a wonderful experience of birth, because the body's not able to do what it's designed to do. And again, it's just critical. If you change the biomechanical components or function of the body, you will always affect the function of the body as well, because this is always related to this. One thing I always say to my the people that I know is that if you have a spinal problem, you're always going to end up with a health problem at some level, because it's all connected. Go ahead. And
do you find that there's one prevalent misconception that you hear a lot about chiropractic care?
What do you think? I mean, what's?
I think there are a lot of them.
Yeah. Name me one thing. Go ahead.
I would say the first thing everyone wants to talk about is the cracking. Crack. It's very rough. And,
Listen, chiropractic started back in 1895, and when they started out, they found out that D.D. Palmer was the developer of chiropractic. Actually, he was the discoverer of chiropractic. He was a magnetic healer in the beginning, and he found out that when Harvey Lillard, who was a janitor that had been deaf for 17 years, was having issues, he found out that one of the vertebrae in his spine was misaligned, creating dysfunction to his hearing. When he realigned that vertebra, it began to allow the nervous system to function again, and he got his hearing back. That was actually the first documented chiropractic patient. Now, in the beginning, there was by hand only that we would use to adjust the vertebrae, because that was the most facilitated way for us to do that. In today's world, there's hundreds of different chiropractic techniques. Some of them use no force or very low force. In our practice, what we actually do is we have an instrument that we use that if a vertebrae is misaligned and we analyze it, we can actually use this instrument to make the correction in a very gentle manner. It uses ounces of pressure. We can be very specific with it as well by using just the tip of it to either the one side or you could use it inferiorly or superiorly. It's a very, very gentle approach. So the misconception that, oh, I'm so afraid to go to the chiropractor because I don't want that cracking, that's one option. I mean, it's still very safe, but at the same time,
it's not for everybody.
There are many ways to adjust the spine. And if those of you that are interested in seeing a baby being adjusted, you can go to our website, drmariano.com. We have
my favorite video.
Yeah, tell them about that video.
The best video ever. Dr. Mariano has a video of a 1-month-old baby that, this is my recount, had never slept more than an hour, was always very upset and colicky, and seemed to be very tense. And the baby and the mom came in for care and an assessment, and you could just see that under Dr. Mariano's care, that he, with a tiny bit of a gentle adjustment here and there, the baby instantly just kind of went, oh, like, I just needed that. I just really needed that, and relaxed. And the mom reported that the baby slept best sleep ever all night. And it's just amazing with such a gentle
And we
change.
just use this instrument on the baby's
You need to find it on YouTube.
Yeah.
What is it called?
Yeah, it's actually on my website, drmariano.com. And then
Really check it out.
It's the first video right on the landing page there.
amazing.
So what other questions? So those of you that are online here, if you want to ask us any questions, feel free to do that. I mean, that's exactly what we're here for. A lot of people, the kind of cases we take care of are usually last resort cases. By the time people get to us, like for example today, we had a child come in that was brought in, 11 years old, and that child actually had had asthma and allergies and throwing up, ever since they were born, and ear infections and tons of antibiotics. And this is just the child's, experience throughout this whole child's life. So they've come in here and the mother said, you know what, it's not getting any better. We're going to the allergist, we're going to immunologists. We've seen all kinds of different doctors, and the same treatment protocol is used, which is to suppress the symptom. We really want another approach where we can actually address the issue. So those of you, Chloe, Vernon, if you have any questions regarding anything about holistic healthcare, feel free to ask us and we can answer those for you.
One other question that I hear often is from my experience, the chiropractic care that I have known in my universe, I guess, is going in when you don't feel well, getting adjusted, feeling a little bit better, and then calling whenever I didn't feel well again, as opposed to I've noticed that here you are looking to actively have a care plan to correct the issue as opposed to just alleviating symptoms. And what do you find is the biggest difference between those?
Right. So here's the thing. Chiropractic is so amazing that you can use it in many different ways. It's just like a tool. So you can use it for pain, because if that pain is coming from a vertebra that's misaligned, then chiropractic can definitely help. However, if you look at that spine again, so the thing is, if you have a spinal misalignment or a subluxation, that's going to compress that nerve that's here, and it can create pain. But you know what? Not all nerves are sensory, so you can have a misalignment that's very slight. As a matter of fact, the research shows even the weight of a dime on the nerve will decrease the function of that nerve by 60% within 1 to 2 minutes. So by the time you have something going on in a pain pathway or pain pattern going on, the body's going to... Think about this. Do you only brush your teeth when it hurts? Would it be a smart idea for you to just brush your teeth when it hurts, and then when it stops hurting to stop brushing it?
No.
Why would you do that? So a lot of people, again, they begin to think that, oh, chiropractic, if I have pain, then, I should get adjusted. If I don't feel pain, or if I can just exercise, I can stretch, I can do all kinds of different things, all kinds of physical therapy. You know what? How you feel is not a good indication of how healthy you are. There are people with high blood pressure, diabetes, what other issues are there? Cardiovascular disease that have no symptoms.
Kidney or liver problems.
Yeah, kidney, liver
gallbladder.
problems. Your liver and your kidneys can be shut down 80% and have 20% function before you even know that you're sick. So if you're using chiropractic care because you have musculoskeletal, that's okay, but that would be like brushing your teeth only when it hurts and then stopping because it doesn't hurt anymore. So there's a different worldview that we have in terms of how to take care of the nervous system. And the reason why that is, again, if you go back to this chart here, that your brain and nerve system control all the function of organs and tissue in the body. And then you can see all the different problems that you can develop over time without you even knowing about it, because these subluxations are very, very slight. They don't cause problems. They don't cause pain until the problem's already been in there, you know. So our approach is, yeah, we'll take care of you. If you have a pain syndrome and it is caused by, you know, misalignments in your spine, we can realign it and give you relief. That's one approach. But the thing is, most of these subluxation patterns in your spine are asymptomatic. And that's been proven again and again by science. Here's another thing. When these nerves get compromised, right? When these nerves get compromised, they affect your organs. Now, question for you, can you even feel those organs? You can't. You know why? Because those organs are autonomic. They're not sensory. So when you have a misalignment in your spine, even if not symptomatic, because it's not a motor nerve or it's not a sensory nerve, you're compromising your nervous system and you're compromising your health. So yeah, use chiropractic if you know, it's a choice that you have. You can use it for pain relief naturally, so you don't have to use NSAIDs or any painkillers that'll kill your kidneys. But at the same time, you can use it for optimal health. It's just like anything. You can use exercise because you've had a stroke and you're trying to rehab yourself, or you can exercise so you can have endurance and a high level of adaptability so the body can take on a lot more stress. And think about today's world. Do we have more or less physical, emotional, and chemical stress? You know, do you think in this world that it's going to become less or more complex? You know, you need to ask yourself those questions. So our approach, again, in our practice is we want to be proactive. We have a totally different worldview. A lot of other people, and you know what, they're entitled to their viewpoint, but I've been practicing for 26 years now. By the time people get to me and they're so damaged and there's so much arthritis in their spines, I feel bad, you know, and I feel bad that those people can no longer be helped. But the reason why they didn't get the help, because they didn't have the knowledge that we're sharing with you right now. Our goal is to be proactive. Getting adjusted because you're not in pain, or getting adjusted because you have pain and waiting till you have pain, it's already too late. Because think about this. Saying, okay, I don't have pain, so therefore I'm healthy. That would be like saying, I don't have a disease, therefore I'm healthy. That would be like saying, oh, I'm not, you know, going to bankruptcy, so that means I have a good financial, you know, solvency. You know, or I'm not getting a messy divorce, that means I have a happy marriage. So saying I'm not in pain doesn't mean I'm healthy. That's not the way the nervous system works. If you really study that. As a matter of fact, they did a study that got discovered in 2016 in the University of Virginia. And they found out that the immune system, they found all these nerves in the nervous system that they didn't know. They said that we thought that the immune system and the nervous system was already mapped out. In 2016, this is the first time in the universe, the world, they found this out, that your immune system and nervous system are one and the same thing. And they found all these lymphatic tissue in the nervous system that they never thought even communicated. Like we talked about before, your whole body is an integrated unit. You cannot separate it. You cannot separate your spine. You cannot separate your spine from the nervous system. It's all one and the same thing. Yes, use it for symptomatic care, but if you really want to get ahead of the game, it's best to keep your nervous system healthy, just like your teeth, before it's too late.
Well, and keep brushing so that you prevent problems and cavities and decay.
Right. Here's another question people go, like, oh, well, I don't feel anything. Like, how did I get these subluxations? Was it because I did exercise or because I was sitting too long? It's like, that would be like asking, hey, where did I get this plaque from? You know, was it from
cavity,
breakfast?
The candy I ate yesterday?
Yeah, was it? What did I get this cavity from that happened, you know, decades ago? Was it from breakfast? Was it lunch, from dinner? If you're going to eat breakfast, lunch, and dinner, you're going to have plaque. Even if you don't eat, you're going to have plaque. It's a natural state of breakdown. So even Newton's law of thermodynamics, the second law of thermodynamics, said this law of entropy. When you don't put energy into something, it goes towards disorder. If you want your muscles to be contracted properly, you have to put energy into it so they can adapt at a higher level. If you want your nervous system to be balanced, because guess what? Because of the mobility of your spine, right, you sacrifice stability. If you can't bend and twist and so on, you would never have to be adjusted. But the fact that you bend and twist all the time, you're always unstable. You're always going to have misalignments in your spine. But the thing is, you're not always going to feel those misalignments. So that's really, really an important awareness that people don't know, and that's why. But you know what? You can't blame people. Not everybody's going to listen. You know why? Because we're human beings. We know we should exercise, but we don't. We know we should sleep well, we don't. We know we should eat cleanly, that we don't. We know we should take our nutrients based on the blood work, but we don't, because we think we can do our own thing. It's a choice you have to make. The question is, how do you know you're doing the right thing? And you know, it's just, I just don't want to see people at the end of their rope, having gone to many different practitioners, say, now can you help me? And that's why we do the holistic approach. The physical, emotional, and chemical need to all be addressed at the same time. And
we really analyze the entire body, top to toe. I saw the other day someone had come in for a knee problem, and I expected that you would just go right to the knee and say, well, what's going on with the knee? Let's see. But you started from the top, all the way to the bottom, and you found that it wasn't because it was the right knee, it was because something was off with the left side that was causing them to lean or, throw off their right side. And if you go and they were going to go to a knee specialist, then obviously a knee specialist would look at the knee, as opposed to, which is helpful, obviously, but not start and just go and find out what's happening with the entire body to throw that off.
The one thing that we're beginning to understand in science now, especially in the science of myofascial connections, and also the way that the tissues basically surround from head to toe through a body, anything can cause anything. So thank God in our practice we use muscle testing, so we can analyze by using muscle testing, no matter what the distortion is in the body that's creating that symptom. Sometimes a small percentage of the time you can have an issue right at that area of complaint. But if you don't stabilize the rest of the spine and nerve system, then that area will always be unstable. So here's another mechanism too. Muscles are there to move joints, right? For example, the muscles in your back, the back here, if you're just sitting still, there's not a problem, they're not contracting. If you want to move and bend forward or bend backward, the muscles contract, otherwise they're just relaxed. Here's the problem. Muscles contracting and relaxing, that's your primary focus, so that you can ambulate, you can move, you can go get your food and don't starve to death. Here's the problem. When you have a misalignment in the spine, the body perceives that misalignment to be dangerous because you're jamming the joints, the mechanoreceptors are overburdened, and the body now, instead of allowing the muscles to be prime movers, they become stabilizers. But the problem is, you don't know, because it's so slight, it's microvolts in terms of contraction, because the body's very forgiving. So if you leave that misalignment there for a long time, the body gets used to it, and these are the problems that develop, become a disc issue and so on. See that? So it's a different worldview we're trying to share with you today, and not a lot of people really understand that. But it's our duty to let people know that if you really want to be healthy, just like anything in your life, you want your car to run well, change the oil, Another analogy that I like to use in terms of our practice is that there are people that want to use their car and they only bring it in when it breaks down because that's all they can afford. Oh, okay, my car broke down, I have to change the transmission, that's $3,500, or the piston broke, but I couldn't really maintain it the way I wanted to because that's all I could afford. Well, that's one way to do it. Wait till something breaks down and then fix it. The way we like to work with our practice is we encourage people to be high efficiency cars, meaning, do you ever see those cars, what do you call the Daytona 500, right? So those are race cars. Think about this. Do those cars stop at the pit stop when they're broken, or do they stop when they still have plenty of gas, right? Their tires are still good. They stop, they could be first place, and they will pull into the pit stop and get passed by somebody else, because what's their goal is to win.
And to prevent a problem.
Right. So if you still change your tires when the tires are still good, and you can make it the best tires that you can have and put gas in there so that it's always full, that's how you win the race. See, you can either take your body or your car to fix it when there's something wrong, when you have a symptom, or you could be like the Indy 500 car and stop at the pit stop, let somebody else pass you, so in the end, you win.
It's also a good way to, as an example, to say that it's not always the easiest choice. It would be easier to just keep going. I mean, at least in your mind as you're going, but to stop and take the time, both, yes, but to stop and take the time to do this, do the preventative so that you have prevention of a future problem. I think that's a big deal. And it's a harder choice, but you're investing in your outcome. Yeah.
And so, so if none of you have any other questions, we're going to start closing down soon. If you have any questions, just type it in on the, hey Angela, it's good to see you. We missed. Hope you had fun in Florida. Chloe, if you have any questions as well, go ahead. Feel free to type it in, and we can answer some of those for you. Another FAQ. What other things can you think of?
How about? I think a lot of people are curious about other things that we can offer them here at Mariano Holistic Life Center. Like maybe you could touch on NET therapy or MPS or cold lasers. We have so many amazing.
We have so many different.
Hi there.
We have many different tools that we use, but keep in mind the whole goal for the tool is not like a physical therapy equipment. For example, we have the cold laser here, right? So we have the cold laser. If you use the laser, you can see it's really, really bright. And what that does, it helps reduce inflammation. It helps the tissue heal. Now, you can use the laser as a physical therapy equipment, but the way we like to use it is to actually upregulate the system so that the body can function optimally. Again, going back to the idea that if you have a joint, for example, that is misaligned, the body perceives that to be a dangerous situation. So what will happen is that the body then, the muscles, instead of contracting 50% here and 50% here, the muscles will shut down maybe 5% here. So this way, when you move your body, your joint that way, you won't fracture it. That is called a myotomal inhibition. So what we do, we analyze that by having some person, bend their head forward and then backward, and then doing a muscle test. So that if they bend their head forward, for example, and that arm goes weak, we can use the laser to optimize that part of the body, and it allows that brain to talk to the muscle and say, wake up, contract properly, and then we make an adjustment to the spine. So we have many different things that we use. We have many tools. We have the laser, we have the kinesiotaping, but all these tools, really, the whole purpose is to remove interference in the body so the body can function optimally.
It also helps to heal itself.
Yes, the bottom line is that, the default setting of the body is to heal itself. When there's interference in the body, then the body's not able to function optimally. Think about the body, because the body was actually came from two cells, the sperm and the egg. From those two cells, the division happened, and it became differentiated from those two cells without any help from the mom and dad after the conception, that the body has a programming to develop itself and to grow. And that is all run through the nervous system. The first thing that develops when you come from the tissue is the primitive streak, which is the notochord, which is also what becomes the spinal cord. So the first thing to develop, and that's how important it is the spinal cord. And from there, the buds come out, and that's where you have all the organs coming from there. So the nervous system is the only system as well that's protected by bone. If you look at the skull up here, it's protected by bone. That shows you the importance of it. Okay.
It seems, as I'm learning, that the more aligned the spine is and the less subluxations, the more you kind of let us get out of our own way to let the body heal on its own and learn how to take care of itself.
Another approach we have that's unique in our field is that we don't tell the body what to do. For example, if you have pain in a particular area, we don't try to remove that pain. We don't try to reduce that pain by using natural substances. Because if you're using natural substances to remove the pain, if you're not identifying the cause of that problem, you're still not addressing the core issue, and then you'll have a recurrence. So our goal is, when we do the muscle testing, we actually analyze the body and ask the body permission, and ask the body, okay, for example, you have a knee issue, a hip issue, a chronic, migraine issue. We need to ask, is it physical? Is it emotional? Is it chemical? Is it nutritional? Is it dehydration? Is it lack of sleep? You always have to identify different patterns of misbehavior and restore that to its normalcy, and then the body can heal the way it's supposed to. If the body is in balance, the nervous system is in balance, you can adapt a lot better than if it was not.
Yeah, definitely. Pretty amazing what we can do when we let ourselves heal.
So we're going to close up now because there's no other questions. This can be one of our Q&A videos that we will be doing periodically. So if you have any other questions, feel free to make some comments on the bottom, and we'll answer it on our next video. And I wanted to share with you a story. When my brother turned 13, he's 5 years younger than me, I said, how does it feel to be 13? And he said, just 3 more years. Why does that mean 3 more years?
Until he can be 16 and
what happens at 16?
Drive.
Right. Mm-hmm. So he said, when I'm 16, that's when life will begin for me. Mm-hmm. That's when I'll be happy, because then I can drive, I can be independent. But guess what? He drove, he was independent, he still wasn't happy. Mm-hmm. And he said, you know what? That's not it. I think that once I get a job, then I'll be happy. Once, I'm working at McDonald's right now, I don't really like it. So if I get a real job and I make real money, then I'll be happy. He wasn't happy. So you know what else he said? You know what? I'm lonely. If I can only find a girlfriend that would love me unconditionally, then I'll be happy. Mm-hmm. He's still single. He still hasn't found that girlfriend. You know what I'm saying? So the problem is, people go through their lives and they were waiting for that important thing to happen to them. I contend that the most important thing is happening now. The most important thing in your life is happening right now. And that if you wait until it's too late because you're not motivated to do it now, you have to have these proactive approaches if you want your life to be where it needs to be. So thank you, Jody, for the interview. And our hope here is that those of you that have listened to this video, or you want to share this with others, is that you've been given the opportunity to have a different worldview of how the body works, where health comes from, and where you can actually have a capacity to be healed as well. So for those of you that have found value in this video, go ahead, give us a like, please. And also, those people that you know, we guarantee you that there are people that you know, your friends, your relatives, even your family members, that are having challenges with their health. They've been to different doctors, they've tried different specialties, and they're still suffering. We ask you to please forward this video to them, and they get some information and how they can be helped, so they stop suffering. And again, this is Dr. Dennis Mariano. Until we see you again, until next time. And this is Jody. Have a good night and enjoy yourself. Take care.